Hello YouTube and welcome to another video. Today, one story rules above all. The entire world can't stop talking about the novel coronavirus, also known as COVID-19, or what we'd like to call it, the panic button. We totally have it under control. It's going to be just fine. Those were the words of US President Donald Trump when he recently weighed in on the news of the potential spread of the new coronavirus to the United States. How wrong was he? While it's true that we're not defenseless in the face of the pandemic, we're also unprepared and we're handling a lot of things wrong. It's now in 110 countries with over 650 confirmed cases, and it looks like it's only getting worse. The World Health Organization has officially changed the designation of coronavirus from epidemic to a global pandemic. Why? Well, the results speak for themselves. The virus has spread its influence across the four corners of the globe into multiple continents. You could call the virus Mr. Worldwide at this point. While China appears to be succeeding in dramatically slowing the spread of the coronavirus within its borders, COVID-19 continues to explode elsewhere in the world. In the US, people are just beginning to realize the severity of the situation. Cases are now present in nearly half of America's states, and the panic rush to buy food and cleaning supplies is on. China's response to the COVID-19 coronavirus outbreak was massive. Entire regions were locked down. Factories were mobilized to produce medical equipment. Hospitals built in days and millions of people quarantined. But all that didn't stop the virus from spreading around the world. In 2018, President Trump did something that most people probably didn't pay attention to. Any guess? Anyone? He shut down the teams that dealt with pandemics at the Department of Homeland Security and the White House National Security Council. Trump also cut funding to the Center for Disease Control's Global Health section, which had been working around the world, training local workers in how to detect outbreaks, building up labs, and emergency responses. The goal was to stop future outbreaks where they start before they spread far, but budget cuts forced that program to leave 39 out of the 49 countries it was working in. So what's gonna happen now? America's already done wrong with its policies. Trump also tried to cut the Public Health Service Commission Corps by 40%. Bad move there, Donnie. America doesn't simply have enough hospital beds to handle the expected influx of patients suffering from COVID-19. In many places, that shortage of beds is the result of state-level regulations known as Certificate of Need laws, or CON laws, Trump's favorite. America had artificially limited the supply of medical equipment. Those laws help politically powerful hospital chains limit regional competition and inflate healthcare costs. But they also create shortages of medical equipment that could prove catastrophic during a pandemic. What we're going to say here is of utmost importance. The most important thing in a pandemic is that you should have a government that tells the truth and you have people that trust in their political institutions. It's a two-way street because those institutions are the one who are going to manage that risk. It took our president 2 months from the start of the outbreak in China for him to put someone in charge of the US response. And when Trump was asked about whether the deep cuts to the health budget or loss of experts would make it more difficult to fight an outbreak, he said this, quote unquote, "And rather than spending the money, you know I'm a business person. I don't like having thousands of people around when you don't need them. When we need them, we can get them back very quickly." Trump took the rare step of delivering a formal address to the public from the Oval Office. It turned out to be a total catastrophe. How bad could 10 minutes of reading a speech from a teleprompter possibly be? Not as bad as the coronavirus, but still pretty bad. The entire focus of the speech was wildly misguided, focused on ginning up racism and restricting travel from abroad when the coronavirus is already spreading, seemingly uncontrolled inside the United States. It seems like the Trump administration doesn't take disease prevention seriously, and it's a total shame, since the US does have some of the world's best scientists and medical facilities. What it doesn't have, though, is universal healthcare, and that's another problem to point out. And that's the end of part 1.
If you want to know more, you can watch the second video here.